What if your pain is not coming from your body at all? What if your anxiety is not coming from your body at all? What if your tiredness is not coming from your body at all? What if all of it is coming from your brain? A brain that is trying to protect you. A brain that is doing its job a little too well. Stay with me. This is not a strange theory. This is real science. And by the end of this video, you will see it for yourself. Here is what we are going to cover today. First, we are going to talk about why so many people get scans, x-rays, and blood tests, and everything comes back normal. No damage, no injury, no clear cause. But the pain is still there. Still real. Still ruining their life. Second, we are going to talk about something that will surprise you. Some people who have suffered for years, for 10 years, for 20 years have healed in just a few weeks. Not months. Not years. Weeks. Third, we are going to talk about a phrase that most people hate to hear. It is all in your head. This phrase sounds insulting. It sounds like someone is calling you crazy. It sounds like someone is saying your pain is not real. But here is the twist. That phrase is wrong, and it is also kind of right. And once you understand why, everything will start to make sense. Now let me tell you who is behind all of this. His name is Dr. Howard Schubiner. He is not some random self-help author. He is a real physician, a real doctor. And for more than 20 years, he did not just guess about this topic. He studied it. He researched it. He ran clinical trials. He wrote over 100 scientific papers on chronic pain, fatigue, anxiety, and depression. He spent 2 decades of his life trying to answer one question. Why do so many people suffer from pain and fatigue when their bodies show no real damage? And what he found changed the lives of thousands of people. People who were told there was no hope. People who were told they would live with pain forever. People who tried every pill, every treatment, every therapy, and still felt stuck. His book is called Unlearn Your Pain. And it is not just a collection of nice ideas. It is a program, a step-by-step method, backed by trials, backed by data, backed by real patients who got their lives back. So, here is my promise to you. By the end of this video, you are not just going to hear some interesting facts and forget them tomorrow. You are going to walk away with a completely different way of looking at chronic pain. A new lens. A new understanding. You are going to understand why your brain can create real physical pain even without any damage in your body. You are going to understand why stress, emotions, and old habits can quietly turn into physical symptoms. And most importantly, you are going to understand what you can actually do about it. Real steps, real tools, things backed by research, not just guesswork. This is not another video that just makes you feel good for 5 minutes and then leaves you with nothing. This is the beginning of a completely new way to think about pain, fatigue, anxiety, and depression. So if that sounds like something you need, do me a favor. Hit that like button. It really helps this channel grow. And if you are new here, hit subscribe. This channel Bookverse breaks down powerful books like this one so you get the real value without having to read 300 pages yourself. Now let's get into it. Part 1. The Everyday Struggle. Let me tell you a story. Meet a woman we will call Sarah. This is not one specific person. This is a mix of thousands of real stories. But let us call her Sarah, so it feels real. Sarah is 38 years old. 6 years ago, she bent down to pick up a laundry basket, and something in her back gave out. A sharp pain shot through her lower spine. She could not stand up straight. At first, she thought it was nothing. Just a strain. Just a pulled muscle. She thought it would go away in a few days. But it did not go away. She went to a doctor. The doctor sent her for an X-ray. The X-ray showed nothing serious. Just some normal wear and tear for her age. So she was given painkillers. She took them. The pain eased a little. But it never fully disappeared. Weeks turned into months. Months turned into years. She tried physical therapy. She did the exercises. She stretched every single day. It helped a little, and then the pain came right back. She tried a different doctor. This one ordered an MRI. The MRI showed a slightly bulging disc. This must be the cause, they said. So she had an injection directly into her spine. For 2 weeks she felt amazing. She thought she was finally healed. Then the pain returned. Just as strong as before. She tried a chiropractor. She tried acupuncture. She tried a stronger set of painkillers. She tried a back brace. She tried sleeping on a different mattress. She tried yoga. She tried giving up exercise completely, just to rest her back. Nothing worked. Not for long. 6 years. 6 years of pain. 6 years of doctors. 6 years of hope and disappointment. Now, here is the important part. Sarah is not alone. Not even close. Chronic pain affects hundreds of millions of people around the world. Back pain alone is one of the most common reasons people miss work. Millions of people live with fibromyalgia. Millions live with chronic fatigue. Millions live with migraines that strike again and again, with no clear warning. Millions more live with irritable bowel syndrome, stomach pain, bloating, discomfort that comes and goes for years, with no clear cause ever found. And on top of all of this, anxiety and depression are rising every single year. All over the world. In every country. In every age group. These are not rare conditions. These are everyday struggles. Struggles that your neighbor might be facing. Struggles that your coworker might be hiding. Struggles that someone in your own family might be dealing with, right now in silence. And here is the part that makes it even harder. Imagine going to doctor after doctor, test after test, and every single time you hear the same sentence. Your tests are normal. Your scans look fine. We cannot find anything wrong. At first, this sounds like good news. No cancer. No fracture. No serious disease. But then reality sets in. If nothing is wrong, then why do you still hurt? Why can you still not sleep? Why are you still exhausted every single morning, even after 8 hours in bed? This is one of the most frustrating experiences a person can go through. Being in real pain and being told there is no reason for it. Some people start to think they are going crazy. Some people start to wonder if it really is all in their head. Some people stop telling others about their pain because they are tired of being disbelieved. This is the everyday struggle, and it is far more common than most people realize. Why the old medical model falls short. So let us talk about why this keeps happening. Over and over. To so many people. For a very long time, medicine has followed one simple idea. Find the damaged body part. Then fix that body part. This idea works incredibly well for many conditions. If you break a bone, an X-ray will show it. A cast will fix it. If you have an infection, a blood test will find it. Antibiotics will treat it. This model has saved millions of lives. Nobody is saying that modern medicine is useless. It is not. But there is a problem. A big one. This model does not explain everything. Especially not chronic pain. Here is a fact that might surprise you. Doctors have scanned the spines of people who have zero back pain. Completely healthy people. People who feel perfectly fine. And guess what they found? Many of these pain-free people had bulging discs. Some had signs of arthritis. Some had changes in their spine that looked, on paper, quite serious. But these people had no pain at all. None. Now flip this around. Doctors have also scanned people who are in severe, daily pain. And in many of these cases, the scan comes back completely normal. No damage. No clear structural problem. Nothing that should be causing this much pain. So think about what this means. Some people have visible damage and feel zero pain. Some people feel constant, severe pain and have zero visible damage. If pain always came directly from physical damage, this should not be possible. But it happens, again and again, in study after study. This is one of the biggest clues in Dr. Schubiner's entire body of work. It is the thread that pulls the whole old model apart. Pain does not always equal tissue damage. Let that sentence sink in for a moment. This does not mean pain is fake. It does not mean people are imagining it. It does not mean people are exaggerating. The pain is completely real. The person truly feels it. Their nervous system truly produces it. But the cause of that pain is not always a broken or damaged body part. This single idea is the crack in the old medical model. And once you see this crack, you cannot unsee it. If the body is not always the source, then what is? The missing piece. Stress, emotions, and the nervous system. This is where the story gets interesting. According to Dr. Schubiner's research, there is often a missing piece. A piece that traditional medicine tends to ignore. That missing piece is the connection between the brain, emotions, and the body. Let us break this down in simple terms. Life stress can build up over time. Work pressure, financial worry, relationship problems, family responsibilities. This stress does not just disappear into thin air. It goes somewhere. And sometimes it goes into the body. Childhood experiences also play a role. A stressful childhood. A strict household. A childhood where emotions were not allowed to be expressed. All of this can shape how a person's nervous system responds to stress later in life. Certain personality traits show up again and again in people with chronic pain and related conditions. Perfectionists. People who set impossibly high standards for themselves and feel like a failure when they do not meet them. People pleasers. People who say yes to everyone, even when they are exhausted. People who feel guilty saying no. People who avoid conflict at all costs. People who swallow their anger instead of expressing it. People who smile on the outside while feeling overwhelmed on the inside. These patterns do not cause pain overnight, but over time they can quietly build pressure. And that pressure has to go somewhere. Sometimes it shows up as physical pain. Sometimes it shows up as constant fatigue. Sometimes it shows up as anxiety that never seems to fully go away. Sometimes it shows up as depression. Now, here is something extremely important. Something you must understand clearly. This does not mean the pain is fake. This does not mean people are faking it for attention. This does not mean it's all in their head in the way that phrase is normally used. The pain is 100% real. It is not imagined. It is not made up. The body truly produces real physical sensations. What is different is the cause. The cause is not always a torn muscle or a damaged disc. Sometimes the cause is a nervous system that has learned to produce pain as a response to stress, emotion, and old patterns. This is a completely different way of understanding pain. And once you understand it, a huge question naturally comes up. If it is not just about the body, then what is actually going on inside the brain? Why would a brain create real pain without any real damage? And more importantly, if the brain can create this kind of pain, can the brain also learn to turn it off? That is exactly where we are headed next. Because in the next part of this video, we are going to open up the science behind all of this. We are going to explain exactly how the brain creates pain and exactly why this discovery is giving thousands of people real hope. Stay with me. This is where it gets really interesting. Part 2. What is neuroplastic pain? Let us start with one simple idea. An idea that changes everything. The brain can learn pain. Yes, you heard that right. The brain can actually learn pain. The same way it learns a new skill. The same way it learns a habit. Think about how you learned to ride a bicycle. At first, it was hard. You had to think about every single movement. But after enough practice, it became automatic. Your brain built a pathway for that skill. And once that pathway was built, you did not have to think about it anymore. Your body just knew what to do. Now think about a bad habit. Maybe biting your nails. Maybe checking your phone every few minutes. At first, this was not automatic either. But over time, your brain built a pathway for it. And now, it happens without you even noticing. Pain can work the exact same way. Here is how it happens. Imagine you get injured. Let us say you hurt your back. In the beginning, this pain makes complete sense. Your body is sending a warning signal. It is telling you, something is wrong here, be careful. This is a normal, healthy response. Pain, in this early stage, is protecting you. But here is where things can go wrong. In some people, even after the injury has fully healed, the brain keeps sending that same pain signal. Over and over. Long after there is any reason to. Why would this happen? Because the brain has learned this pattern. It has built a strong pathway. And once that pathway is built, it can keep firing, even without any real damage left in the body. This is what is called neuroplastic pain. Let us break down that word. Neuro means related to the brain and nerves. Plastic means something that can change shape. So neuroplastic simply means the brain and nervous system are changeable. They can form new patterns. And once formed, those patterns can repeat. Here is a simple way to picture this. Think about a smoke alarm in your kitchen. A smoke alarm is designed to protect you. If there is a fire, it goes off, and you get out safely. This is a good thing. This is the alarm doing its job. But imagine a smoke alarm that becomes way too sensitive. Now, it goes off if you make toast. It goes off if you boil water. It goes off even when there is no fire at all. Is the alarm broken? Not exactly. The alarm still works. It is just way too sensitive. It has become overprotective. This is exactly what happens with neuroplastic pain. The brain is like that overprotective smoke alarm. It keeps sounding the pain alarm, even when there is no actual danger left, even when the body has already healed. Now, here is something you must understand clearly because it is one of the most important points in this entire video. This pain feels completely real. 100% real. This is not imaginary pain. This is not fake pain. This is not something a person is making up in their mind. The brain is creating an actual physical sensation. Real nerve signals. Real physical feeling. Just like any other kind of pain. The difference is not whether the pain is real. The pain is always real. The difference is where the pain is coming from. Some pain comes from an actual, current injury in the body. Other pain comes from a brain pathway that has learned to create pain even without ongoing damage. Both types of pain hurt just as much. Both types of pain are completely real. Once you understand this difference, a huge door opens. Because if the brain learned this pattern, then maybe, just maybe, the brain can also unlearn it. That idea alone has given hope to thousands of people who thought they were stuck forever. The role of the brain's danger detector. Now let us go a little deeper into the brain itself. Inside your brain, there are regions whose main job is to detect danger. Think of this as your brain's built-in alarm system. Its job is to protect you from threats. This system evolved a long time ago. back when humans faced real physical dangers every single day. Wild animals, physical attacks, life-threatening situations. Back then, this alarm system needed to be fast and powerful. It needed to react instantly to real danger. But here is the problem in modern life. This same alarm system does not just react to physical danger anymore. It also reacts to emotional stress, ongoing worry, fear, pressure, even old memories of stressful events. In some people, this alarm system becomes overactive. It starts treating everyday stress like it is a life-threatening emergency. And when this alarm system stays switched on for too long, it does not just create fear or anxiety. It can also team up with the pain pathways we just talked about. In simple words, your brain is trying to protect you, but it overreacts, and it keeps that alarm switched on for way longer than it should. This is why chronic pain, in many cases, is not really a body problem. It is more like a brain system that is stuck in an overprotective state. Now here is something really important to understand. This same overprotective pattern does not just show up as physical pain. It can also show up as constant fatigue, a tiredness that never seems to fully go away, no matter how much you rest. It can show up as anxiety, a constant sense of worry or unease, even when nothing specific is wrong. It can show up as depression, a heaviness, a low mood, a loss of energy and motivation. Pain, fatigue, anxiety, and depression may look like four completely different problems on the surface, but underneath, they can share the exact same root cause: an overprotective brain, a danger detector that is stuck in the on position. This is a huge insight, because it means that all of these conditions might respond to a similar kind of solution. A solution based on calming this overactive alarm system, rather than only treating each symptom separately. Personality patterns and emotional suppression. Now let us talk about something Dr. Schubiner noticed again and again in his patients. Certain personality patterns, certain emotional habits. They show up over and over in people who develop this kind of chronic pain. Let us go through a few of them. The first is perfectionism. This is someone who holds themselves to extremely high standard. Someone who feels like anything less than perfect is a failure. Someone who is always pushing themselves, rarely satisfied, rarely allowing themselves to relax. The second is self-criticism. This is someone with a harsh inner voice, a voice that constantly judges them, a voice that points out every mistake, every flaw, every shortcoming. The third is people-pleasing. This is someone who puts everyone else's needs before their own. Someone who finds it very hard to say no. Someone who feels responsible for making sure everyone around them is happy, often at their own expense. The fourth is difficulty expressing anger or sadness. This is someone who was taught, often from a young age, that showing anger is bad, or that showing sadness is a weakness. So instead of expressing these emotions, they push them down. They swallow them. And the fifth is growing up in a stressful household. This could mean a home with conflict, a home with high expectations, a home where emotional needs were not fully met, a home where a child had to grow up fast, or take on responsibilities beyond their age. Now, here is the connection. Emotions do not just disappear when we suppress them. They do not vanish into thin air. When emotions are pushed down, again and again, over years, they often do not stay hidden forever. They can resurface. But instead of resurfacing as clear emotions, they can resurface as physical symptoms. Bottled up anger, bottled up sadness, bottled up stress. All of it can quietly build pressure inside the nervous system. And over time, that pressure can express itself through the body, through pain, through tension, through fatigue. Let me give you a simple, relatable example. Imagine someone named John. John never says no to anyone. If a coworker asks him to take on extra work, he agrees, even when he is already overwhelmed. If a family member needs something, he drops everything to help, even at his own cost. John feels guilty almost all the time. Guilty if he rests. Guilty if he puts himself first. Guilty if he even thinks about saying no. Over the years, John starts to notice constant tension in his neck and shoulders. Then it turns into ongoing back pain. He goes to doctors. They find nothing seriously wrong. But the pain stays. According to this framework, John's body may be expressing what his mind has never been allowed to say out loud. All of that suppressed frustration. All of that unspoken exhaustion. All of that guilt he keeps swallowing. It has to go somewhere. And in John's case, it may be showing up as physical pain. This does not mean John is imagining his pain. His pain is completely real. It simply means the true root of that pain may not be a damaged muscle. It may be years of unexpressed emotion, finally finding a way to be heard. 2.4 The proof. What the research actually shows. Now, you might be thinking, this all sounds interesting. But is there actual proof? Or is this just a nice theory? This is where Dr. Schubiner's work becomes especially powerful. Because this is not just an idea he came up with and hoped was true. He tested it. In real clinical trials. With real patients. In one well-known study, researchers took a group of people who had suffered from chronic back pain for years. Long-term pain. The kind that does not go away with normal treatment. These people were divided into different groups. One group continued with their usual care. Whatever treatment they were already doing. Another group was taught this brain-based approach. They learned about neuroplastic pain. They learned techniques to calm their overactive alarm system. They learned how to process emotions instead of suppressing them. The results were remarkable. A large number of people in the brain-based treatment group became pain-free, or nearly pain-free. Not just a little better. Significantly better. In some cases, completely free of pain that had lasted for years. Meanwhile, the group that continued with usual care showed far smaller improvements. This was not a small effect. This was a dramatic difference between the two groups. And this was not the only study. Similar approaches have been tested with other conditions too. Migraines, fibromyalgia, long-term fatigue. In many of these studies, people who learned this brain-based approach showed major improvement, often lasting well beyond the study period. Now, it is important to say this clearly. This approach does not work for every single person, in every single situation. Some pain does come from ongoing physical damage that truly needs medical treatment. That is exactly why Dr. Schubiner always recommends ruling out serious medical causes first, with a proper doctor. But for a very large number of people, especially those with normal scans, unexplained pain, or symptoms that move around and change over time, this approach has shown real, measurable, lasting results. This is not just a theory whispered in self-help circles. This is backed by science, backed by trials, backed by real people who lived with pain for years, and finally found a way out. And that brings us to the most exciting part of this entire video. If the brain can learn pain, and if real research proves the brain can also unlearn it, then what exactly do you do about it? What are the actual steps? That is exactly what we are going to cover next. Real, practical tools. Steps you can actually understand and picture yourself trying. Stay with me. This is where the theory turns into real, usable change. Part 3. Step 1. Believe it's safe. Now we get to the part you came for. The real steps. The real tools. Let us start with step 1. And this step might surprise you. The first step is not a physical exercise. It is a belief. You must truly believe your pain is safe. Not that it feels good. Not that it does not hurt. but that it is not a sign of ongoing damage. Let that sink in for a moment. Your body already healed, but your brain kept the alarm on. So the first job is convincing your brain. Convincing it there is no danger left. This sounds simple, but it is powerful. Here is why it matters so much. Fear makes pain worse. This is proven again and again. When you feel pain and panic sets in, your brain sees this as confirmation. It thinks something must be seriously wrong. So it turns the alarm up even higher. This creates a cycle. Pain creates fear. Fear creates more pain. Round and round it goes. But here is the good news. You can break this cycle. And it starts with belief. When you truly believe your body is safe, the fear starts to fade. And when fear fades, the alarm starts to quiet down too. This is not about ignoring pain. It is not about pretending it does not exist. It is about changing how you respond to it. Here is a simple exercise you can try. The next time pain flares up, pause for a moment. Take a breath, and say to yourself quietly, "My body is safe." Say it again. My body is safe. Not with panic. Not with fear. Say it like a simple fact. Because for many people, it truly is a fact. Their body has already healed. Their tests came back clear. The only thing left, firing, is an overprotective brain. Some people find it helpful to remind themselves of proof. My scans were normal. My doctor found no serious damage. This pain is my brain being overprotective, not my body being broken. Repeating thoughts like these again and again, over days and weeks, slowly it retrains the brain. Teaches the alarm system a new lesson. The lesson is simple. There is no real danger here. This is step one. And it is the foundation for everything else. Without this belief, other tools work less well. But with this belief, everything else becomes much easier. Step 2. Somatic tracking. Now let us move to step 2. This step is called somatic tracking. It sounds technical, but it is actually simple. Let me explain it in plain words. Normally, when pain shows up, we do one of two things. We fight it, or we fear it. We tense up. We brace ourselves. We try to push the pain away. But this reaction often makes things worse. Somatic tracking takes a different approach. Instead of fighting the sensation, you gently observe it. You watch it with curiosity, not fear. Think of it like watching clouds pass by. You do not grab the clouds. You do not fight them. You simply notice them. You watch them move. You let them pass. Somatic tracking works the same way. Let me walk you through a simple version. First, find a quiet moment. Sit or lie down comfortably. Bring your attention to the area of pain. But do this gently, like a curious observer, not a worried patient. Ask yourself simple questions. What does this sensation actually feel like? Is it sharp? Is it dull? Does it move? Does it stay still? Notice the sensation without judging it. Do not label it as terrible. Do not label it as dangerous. Just notice it as it is. While you do this, remind yourself gently, this is safe. My brain is just overprotecting me. Stay with the sensation for a minute or two. You may notice something interesting. The sensation may shift. It may lessen. It may even move location. This happens because you removed the fear. And without fear, the brain has less reason to keep the alarm loud. Why does this technique work? Because fear feeds the threat response. Every time you approach pain calmly instead of with fear, you send your brain a new message. The message is, this is not an emergency. Over time, with repeated practice, the brain starts believing this message, and slowly the alarm system begins to quiet down. This is not an instant fix. It takes practice, but many people find this technique surprisingly powerful. It turns pain from something terrifying into something you can simply observe, and that shift changes everything. Step 3. Processing emotions. Now let us move to step 3. This step goes back to something we discussed earlier. Suppressed emotions. Remember, emotions do not just disappear. When pushed down, they resurface. Sometimes as physical pain. Sometimes as fatigue. Sometimes as anxiety. So step 3 is about processing these emotions, instead of suppressing them. One powerful tool for this is journaling, also called expressive writing. Here is how it works. You take a notebook, or an app, anything you prefer, and you write, freely, without censoring yourself. You write about what is truly bothering you. Maybe it is stress from work. Maybe it is an old memory. Maybe it is a relationship struggle. You do not worry about grammar. You do not worry about making sense. You simply let the words come out. Here is a simple way to start. Ask yourself, what is really bothering me right now? Then write without stopping. For 10 minutes. Do not hold back. Do not judge what comes out. If anger comes up, write the anger. If sadness comes up, write the sadness. If guilt comes up, write the guilt. Let it all hit the page. After writing, take a moment. Read back what you wrote. Look for patterns. Are there themes that keep repeating? Are there feelings you have never said out loud? Are there people or situations connected to your symptoms? This process is not about finding perfect answers. It is about giving emotions a way out, a way other than through the body. Here is why this matters so much. Suppressed emotions create background stress. This constant, hidden stress feeds the danger alarm we talked about earlier. It keeps the system on high alert. But when you express emotions, even just on paper, something shifts. The nervous system gets a release. The background stress slowly lowers. And when background stress lowers, the pain alarm often lowers too. This does not mean one journal entry fixes everything. But done regularly, this practice can create real change over time. Many people discover things they never realized. Old resentments, hidden fears, feelings they never had permission to feel. And simply naming these feelings often brings real relief. Not because the problem disappeared, but because the emotion finally had a voice. Step 4. Building new habits and confidence. Now let us move to the final step. Step 4 is about action. Real, physical action. Because belief and emotional work are essential. But at some point, you must also prove it to your brain. You must show your brain through action that you are safe. Here is what this means. Slowly returning to normal life. Movement that you avoided out of fear. Work that you scaled back due to pain. Social activities you gave up to protect yourself. The key word here is slowly. This is not about pushing through pain recklessly. It is about gradual, confident step. Let me explain with a simple idea. Every time you avoid something out of fear, your brain learns a lesson. It learns, this activity is dangerous. And this reinforces the very alarm we are trying to calm. But every time you gently try again, and nothing bad happens, your brain learns a new lesson. It learns, this activity is actually safe. This is called proving it to the brain. Little by little, step by step. Maybe you start with a short walk, one you have been avoiding. Maybe you return to a hobby you gave up. Maybe you slowly increase your work hours again. Each small success builds evidence. Evidence that your body can do this. Evidence that safety is real. Over time, this builds confidence. And with confidence, fear continues to shrink. and as fear shrinks, so often does the pain. Now, one more important point. Not everyone can do this alone. Some people benefit greatly from extra support. Therapy with someone trained in this approach. Support groups of people going through similar struggles. Structured programs designed around this method. There is no shame in needing guidance. In fact, many people find real breakthroughs with the right support. Before we finish this section, one final, important reminder. This approach works best after ruling out serious medical issues. This is not a replacement for proper medical care. It is an addition. For the right cases, always start with a proper medical evaluation. Make sure nothing serious is being missed. Once serious causes are ruled out, this brain-based approach can become a powerful next step. So let us recap these 4 steps. Step 1. Believe it is safe. Step 2. Somatic tracking. Observe, do not fear. Step 3. Process emotions. Do not suppress them. Step 4. Build new habits. Prove safety through action. Together, these 4 steps form a real, practical path. A path that has helped thousands of people. People who felt stuck for years. People who found real relief. Real, lasting change. And in our final section, coming up next, we will bring everything together. A quick recap. A final message. And what you can do starting today. Part 4. Wrap-up takeaways. We have covered a lot today. So let us bring it all together. Let us start with the big shift. The one idea that changes everything. For years, we were taught something simple. Pain means damage. Find the damage. Fix the damage. But now you know better. Pain does not always mean damage. Sometimes pain comes from a brain trying to protect you. An overprotective brain. Stuck in alarm mode. Sending pain signals. Long after healing. This is true for chronic pain. It is true for chronic fatigue. It is true for anxiety. It is true for depression. Different symptoms. Often the same root cause. An alarm system stuck on. This does not mean your pain is fake. It never means that. Your pain is real. 100% real. It simply means the cause is different. Not always a broken body part. Sometimes a brain pathway. One that learned the wrong lesson. And here is the hopeful part. If the brain learned this pattern, the brain can unlearn it too. That is the entire message of this book. Now let us recap the 4 steps. The real, practical tools. Step 1. Believe it is safe. Truly believe your pain is not ongoing damage. Remove the fear. And the alarm starts to quiet. Step 2. Somatic tracking. Do not fight the sensation. Do not fear it. Observe it gently, like watching clouds pass by. Step 3. Process your emotions. Do not suppress them. Write them down. Name them. Let feelings find a voice. Instead of hiding in the body. Step 4. Build new habits. Slowly return to normal life. Prove to your brain, step by step, that you are safe. 4 step. Simple on the surface, but powerful in practice. Steps backed by real trials, real research, real results. Now, here is something I want you to remember. Thousands of people felt exactly like you might feel right now. Stuck, frustrated, told nothing is wrong, while still in real pain. Some of them suffered for years, 10 years, 20 years, some even longer. And yet, many of them found relief. Not through another pill, not through another injection, but through understanding their own brain, through learning to calm their alarm system, through finally expressing what they had buried for years. If they could find relief, so can you. This video gave you the big picture, the core ideas, the core step. but the book itself goes so much deeper. Unlearn Your Pain by Dr. Howard Schubiner. It includes full exercises, step-by-step guidance. It includes real patient stories, people just like you, people with back pain, migraines, fibromyalgia, anxiety, people who walked this exact path. If anything in this video connected with you, I truly encourage you to pick up this book. Read it fully. Try the exercises yourself. Give yourself the full program, not just the summary, because real change deserves real effort, and this book gives you a real roadmap. Now, before you go, let me ask you something. Out of everything we covered today, which part surprised you the most? Was it the idea that scans can look normal while pain is very real? Was it the smoke alarm example? Was it the story about John? The bottled-up emotions? Or was it the research? The actual trial results? Whatever it was, I would love to know. Drop a comment below. Tell me which part surprised you most. And if this video gave you value, please hit that like button. It genuinely helps this channel grow. And if you are new here, hit subscribe. This channel book verse breaks down powerful books like this one, so you get the real value. Without reading 300 pages yourself, we will keep bringing you more summaries, more insights, more tools for a better life. Thank you so much for watching. And remember, your pain is real, but your brain is capable of so much more. It learned this pattern once, and with the right steps, it can learn a new one too. Take care of yourself, and I will see you in the next video.